I'm David Teitelbaum. I'm an osteopathic physician and have practiced in the Fort Worth area for almost 30 years. For over 20 of those years, I've provided prolotherapy for my patients. Prolotherapy is the injection of ligaments to thicken and strengthen them. You can also use prolotherapy on tendons. Ligaments are the leathery straps that connect bones to bones, and tendons connect muscles to bones. In prolotherapy, we inject those structures with chemicals that deliberately irritate them. In response to that, the body lays down collagen and they thicken and strengthen. The two main irritating chemicals we use are dextrose in a concentrated solution and polydocanol, which is an irritating local anesthetic. Although it seems counterintuitive to think that injections of an area can bring about natural healing, that is the case with prolotherapy. The shots themselves do not bring about the healing. The shots themselves simply stimulate the body to heal itself so that the tissue that forms is a natural thickening of the tissues that are already there. Prolotherapy can be quite useful for a number of problems. In spinal conditions, we use it in the neck for whiplash injuries and for other neck injuries, and also in tension headaches along the base of the skull. We use prolotherapy for low back pain regularly and sacroiliac problems. We also use prolotherapy quite a bit in sports medicine for shoulder injuries, where we've done a number of pictures, and people with rotator cuff tears that are not complete tears of the tendons involved. In elbows, we treat golfer's elbow and tennis elbow, and the wrist, a host of problems, strains, sprains, and even carpal tunnel. We do inject hips. We also do knees for collateral ligament tears or for cruciate tears if the ligament is not completely severed. We also do ankles for sprains and strains and certain foot problems. Prolotherapy is a very useful modality in my practice, so I wanted to make this video to explain it to my patients, and you will get to see me provide prolotherapy in an elbow and in a low back. Now we're going to do an elbow. We're going to do the support ligament on the inside of the elbow, the support ligament at the outer part of the elbow at the radial head, the ligament that goes between the two bones of the forearm, the interosseous ligament. And you can also use prolotherapy on tendons, so we're going to use it on the supinator muscle and the biceps brachii. And stick. This is the tendon of the biceps brachii. There, okay. Tendon of the supinator. This is the interosseous ligament. And that's the elbow. Now we're going to be doing a low back. In this patient, there are not that many sides that need to be done. There's the very important stabilizing iliolumbar ligament, and they're going to do the lower two spinal vertebrae, those being L5 and L4, where they connect to each other. Okay, so this is the iliolumbar ligament. And I'm going to stick. This ligament is key for low back stability. Okay, this is the L5 S1 junction. So it's the lowest vertebrae of the spine where it attaches to the sacrum or tailbone. And for each vertebra, we inject it 3 times in the middle and then on each side. And last, we're going to do the junction between the L4 and L5 vertebrae. And that's it for this patient.